Hello there, Janelle Tennyson here with the Joint Replacement Academy. Last week I posted in the Facebook group about some chatter that I had noticed regarding the idea of securing a relationship with a physician at a pain management clinic prior to having knee replacement surgery. So the concern was making sure that you as a patient would have adequate access to pain medication postoperatively. I can understand the idea behind that, but here's the thing. Rather than seeking out a third physician at a pain clinic, your better bet is to plan to have a really successful interactive relationship with your surgeon about your pain management plan. So that means having a really honest and thoughtful conversation about this whole thing before surgery. Find out exactly what your surgeon plans to do to keep you comfortable in every phase of recovery. So in the minutes after surgery, as you're waking up, in the hours that follow, the days that follow, and then the weeks after that. Be really clear about who your phone a friend option is, or that person that you should contact if you're struggling with pain control or any other aspect of recovery for that matter. So get crystal clear on who your helpers are after surgery or who your resources are. So last week we talked about iovera injections. This week, let's discuss nerve blocks and how they can improve your pain experience after a total knee replacement surgery. The most common type of nerve blocks that are used now are adductor canal blocks and genicular blocks. A third type called ephemeral nerve block provides probably the best pain relief, but it's rarely used because that type of a block really greatly hinders the strength of the quadriceps muscle, causing your leg to feel really limp and like a noodle. And that is a huge fall risk in my opinion, and it's not worth the trade-off. There's really few things that can derail a successful recovery as quickly as a fall can. So what's a nerve block? Think of a nerve block as a temporary pause button for pain signals. So before surgery, your anesthesia team would use an ultrasound machine to guide them, and they would inject just a small amount of numbing medication around the nerves that deal with pain signals in the knee. So a nerve block that preserves the strength and function of those quadricep muscles is a great choice. You definitely want to be able to stand safely and walk and participate in physical therapy shortly after surgery. What does getting a nerve block mean to you? Well, your surgeon or your anesthesiologist will have their preferred type of block, and they'll explain that to you, why one is better than the other and why they choose one over the other, whether it's an adductor canal block or a genicular block or a different kind. Either way, it really should mean that you will have less pain in many regions of the knee after surgery. You'll have better mobility in the early recovery period, and you'll kind of get a head start with your recovery. Let's be clear though, I am not going to overpromise about what it means to have a nerve block. You will still need pain medication. You still might wake up having a great deal of pain, but a nerve block does provide an extra layer of relief. There are one-shot injections, which are the most common. Depending on the type of numbing medication that's used, typically the results or the effects of a nerve block will last between 12 and 24 hours. In some cases, if you're really lucky, a tiny catheter might be placed in and left in your leg, and then it would be connected, that little catheter would be connected to an elastic ball that is filled with the numbing medication, and then the elasticity of the ball would slowly drip just a couple drops of the numbing medication on that nerve for a couple days after surgery, sometimes up to about 3 days. After 3 days, then you would pull the little catheter out and go on with your recovery. The truth is, though, that not all hospitals offer it. Probably pretty few do, mainly because of the cost of the system. So what will it feel like? While a nerve block is being administered, you might feel kind of some pressure in the area or a tingling sensation. You might feel a cool sensation as the medication spreads through the area. And then about 15 or 30 minutes later, then you would feel that numbness and the pain relief. Truth is, though, in 15 to 30 minutes, you're probably going to be back in surgery and you won't be aware of the onset of that. So if your surgeon or your anesthesia team offers a nerve block, it's absolutely worth considering. It can make those first crucial hours and days after surgery to be a whole lot more manageable. So stay tuned, because next week I'm going to discuss the ways that surgeons can inject directly into the knee during surgery to further enhance your pain experience. Have a good day, everybody.